We are back with another segment with Dr. Nikita Desai. She's talking about asthma and ways to manage the condition if you have it. All right, so we were just talking about what some of the symptoms are and things of that nature. Now I want to know, when do you go to the doctor? Because that is always the age-old question, no matter what it is. When do we go?
That's a great question. And so when I get to start getting concerned about a diagnosis of asthma, I'm looking for someone who's had chronic, recurrent, again, those episodic conditions. And so on average, we say getting bronchitis or an upper respiratory infection once a year is considered normal. Anything more than that, if you're someone who's getting bronchitis multiple times a year, or if it's typically associated with seasonal allergies or any seasonal changes, or if you feel like when you get an upper respiratory infection, you have symptoms that linger far beyond anyone else in your family, those are times when I would be concerned that there's something else at play.
Right, when that cough just doesn't go away for a month or two, that kind of thing, you probably need to go back and revisit that. All right, so what might make someone's symptoms flare up? Maybe they lay dormant for a little while and then they come back again.
Yeah, so I think you're asking sort of what are common triggers for asthma. And certainly here in North Carolina, the first one that comes to mind is because of our beautiful trees and flowers. We have a lot of allergic symptoms related to pollen, which is a very common trigger. Upper respiratory infections, especially viral infections, more so than bacterial, are common trigger for asthma. But other things like exertion or exercise, stress, dust mites, cats, dogs, smoke, all of these things can affect us, and air quality is an important factor for that too.
Okay, and I'm guessing this is going to roll right into this next question that I have, which is, of course there's medication out there, right? But what can any of us do to help kind of control those kinds of triggers?
Yeah, I think there's only so much we can limit. But, in the last couple of years, we've become really good as a society for avoiding sick people and trying to take reasonable precautions. So avoiding getting sick with an upper respiratory infection, especially those viral infections in the wintertime, is super important. If you know you've got allergies, treating those allergies and maybe even getting allergy shots, if that's indicated, would be important. And really treating all your other conditions that could make asthma worse. So if you have sleep apnea, if you have acid reflux, if you have sinus disease, those are all important things to get under control, to get your asthma under control.
Okay, and if someone has asthma, they might feel like they want to stay away from exercise because they're having difficulty breathing and that kind of thing. So do you recommend people with asthma exercise?
Yes, absolutely. So while I did mention that exertion can be a trigger for asthma, exercise is so important for your health, but especially for your pulmonary health. And so talking with your doctor, if you do have asthma, about safe ways to start exercising and keeping that a part of your routine is also something you should ask about.
Okay, and that is going to be my follow-up question, of course. Like, how do we manage our symptoms while we exercise?
That's something you would want to talk with your doctor about, but a lot of times people take inhalers for their asthma, and that's part of the treatment. And there's maintenance inhalers, which you take every day, and there's rescue inhalers, which you just take sometimes. But sometimes those rescue inhalers can be used almost preventively to help make exercise safer. But again, that's something you should talk with your doctor about.
Mm-hmm. Okay. Now, it's flu shot season, of course. We have an updated COVID booster that doctors are recommending. What should people with breathing conditions do to stay updated on their vaccines?
So definitely follow up with your primary care doctor, your pulmonologist, or whoever helps take care of you about getting those vaccines and getting them up to date. They are super important because we have really good evidence to say that preventing infection and preventing recurrent flares or exacerbations of asthma can help maintain lung health and function.
Okay, asthma attacks can be really scary. So what are the early warning signs of an asthma attack so we can kind of prepare ourselves and change course?
Yeah, so I would say, sudden onset of shortness of breath, chest pain, coughing. If it's triggered by something and if you can identify a recurrent episode, that's super helpful. So if you do go see your doctor and if you have some diary or some identification of things that seem to set you off every time this happens, that will be very helpful for whoever's taking care of you to help make this diagnosis.
Okay, and if people are experiencing an asthma attack, they should do what?
Well, there are different degrees of severity for asthma attacks, but certainly if you're unsure, if you have episodes of inability to catch your breath, if you can't finish sentences, if you have a pulse oximeter and your oxygen levels are dropping, those are all signs to go to the emergency room. If your symptoms are more gradual and kind of slowly coming on, you may have some time to talk with your primary care doctor or to talk with a pulmonologist.
Okay, and it's good to make that differentiation so you know. All right, great information. We want to make sure you at home have all of this information. Maybe you need to share it with a family member. Check out our 2-Year Well-Being section. We're going to have it all posted there shortly.